So Jenny's been in the oncology field since 2010, and she's worked in a variety of settings, and she's cared for a wide variety of people with cancer, with all sorts of cancer diagnoses. And after she witnessed a great need to address cancer-related fatigue and deconditioning, she took a special interest in the exercise oncology field. And that has resulted in her becoming a personal trainer and cancer exercise specialist. And she facilitates a nurse-led exercise study, or did, within the neuro-oncology population, and that was studied in an oncology nursing journal in April 2021. And from there, her passion for exercise oncology grew as she witnessed how powerful it is and all the potential there is in exercise and in improving quality of life and decreasing cancer-related fatigue. She is continuing to work as an oncology nurse navigator and speak on cancer-related fatigue and exercise oncology, and I'm just delighted to introduce Jenny Spencer and her baby.
Thank you so much for that introduction, Laura. And I'm sorry that Dr. Mary wasn't able to make it. Hopefully, we have a good session here together tonight talking about cancer-related fatigue. As Laura mentioned, I took a special interest in it. I've been an oncology nurse for the past a little over 15 years. And I just saw how many patients were impacted by fatigue and started to research and learn a lot more about it. So we'll talk about that today. And it looks like we have people from Los Gatos, Delray Beach, Maui, Virginia. Thank you, Rosalie. Techniques for reducing fatigue. We'll definitely talk about that, what the research shows. And I'm just delighted that you all are here today. We have a good group. And my husband was on duty, but she was just not settling too well. So thank you for your patience and understanding of having my little Vivian here with me. She turns 4 months tomorrow. So thank you for being understanding with her. All righty. So we talked about what fatigue, that we were going to be speaking on that today. Okay. And I want to take a minute, as we were, discussing fatigue is a pretty common, if not one of the most common symptoms within cancer care and what patients experience. And it's important to recognize that there was a survey that, relayed, 50% or so of patients felt like this fatigue was just something to kind of deal with as you go through your disease. And, as we talk today, that does not have to be, oh, I'm sorry, hold on one second. I am going to. All right. I handed Vivian off. So thanks for your patience again. And I want to be fully present with you all today because this is very important to me. And I hope that if I'm able to help anybody in this demeanor of their cancer care, I would be thrilled. So I just want to emphasize that you can get so entrenched in your cancer care, and you are more than that, right? You have a life outside of everything that's going on within that bubble. So it's so important that you, your family, your care team help support you in all the ways possible so that you're able to get through your treatment or survivorship phase, but also able to have a good quality of life, or trying to have the best quality of life while doing that, because there's other aspects of your life that you have to show up for. So what is cancer-related fatigue? Based on the National Comprehensive Cancer Network, the definition is a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer or its treatment, And what is important to note is that it's not proportional to recent activity and it interferes with usual functioning. So this is a fatigue that is different from a fatigue that someone else that may not be going through cancer is experiencing, where they can maybe, take a nap during the day and feel relieved or revived after from their fatigue. Sometimes taking long naps during the day, especially when they are longer, can actually have fatigue get worse in the patients, in cancer patients. And then it also interferes with usual functioning. So it's not just that physical sense of exhaustion, but it's also emotional and or cognitive, and that can interfere with your ability to do activities during the day and then also potentially work if you're using a lot of your mental capacity for that. It can also be a dose limiting toxicity based on performance status. And what that means is sometimes if you come in and you are feeling so fatigued that you're not able to carry out your usual activities of daily living, the team may decide, hey, maybe we need to dose reduce what you are taking, or we need to skip this dose and reassess next week. And it is also associated with a decreased quality of life. So all of those factors making it very meaningful to help address fatigue. The prevalence of fatigue is, there are wide ranges reported. Some reported meta-analyses say up to 99% of cancer patients can experience it at some point in that cancer care continuum, with an estimated about 50% overall. And then also patients can still feel fatigue going into late survivorship phase. So this could be 5 years after treatment. And sharing those statistics is to, emphasize that you are not alone in feeling that way. So that fatigue that you're feeling that is kind of draining your daily activities and your mental and or emotional capacity, you are not alone in feeling that way. So coming from the nursing lens and the healthcare lens, we think about, well, this is a problem. It's the prevalence is high and it's impacting multiple dimensions of quality of life for our patients. So we want to see, well, why does cancer-related fatigue occur? Potentially that can lead us in the direction of what we can do to help relieve it. And unfortunately, the causes of CRF are very widespread, and they are still being explored because there are so many different dimensions of cancer-related fatigue, and there are so many dimensions of also what's going on in your cancer care that can potentially predispose you to having fatigue, or also make the fatigue worse. So such as treatment. If you're on certain treatments that interfere with your blood counts, like your red blood cells and your hemoglobin, then that can maybe make you feel more tired. Or maybe it's interfering with your thyroid function or your endocrine system, which those changes can also make you feel more tired, or your hormones. Sometimes lifestyle habits interfere with your fatigue. So certain diet, like poor diet, poor physical activity, increased stress, those can all exacerbate cancer-related fatigue. And then other medical conditions and medications that you may be on may contribute to it. And then there's these central and peripheral hypotheses, which we won't go into really depth here. We'll just touch on it on this slide. And this is referring to some, new evolving research looking into fatigue and why it happens, specifically in the cancer population. And it is focusing on, for the central hypotheses, like, the maybe inflammatory response from cancer treatments and or cancer itself that happen, that can disrupt at the cellular level, like your stress response or the inflammation itself that can cause the cancer-related fatigue. And furthermore, what's happening at those cellular levels, are there peripheral hypotheses or reasons why the fatigue's happening that's making your muscle not be able to contract as well, or making it fatigue easier? So they're looking into those causes right now as well. So unfortunately, in that regard, we don't have like much research on why exactly, it happens and pinpointing that cause. However, there has been a lot of research on what we can do to help either reduce, mitigate, and treat cancer-related fatigue. So how to prevent and treat cancer-related fatigue. The current research shows that non-pharmacological interventions are superior than pharmacological interventions, and can significantly improve CRF. I just pulled up the chat, and Christina, we can definitely talk about information. Yep. Thanks, Christine. Information about aromatase inhibitors and fatigue. So what is the research showing? There was ASCO, which is the American Society of Clinical Oncology, that guides a lot of the clinical oncology care in the cancer realm, came out with updated recommendations for cancer-related fatigue management. It was either 2024 or 2025. And what they found, so they looked at all the evidence that's been done on cancer-related fatigue and interventions related to it. And a lot of those research studies are, randomized controlled studies. So just as if, you were in a clinical trial for the treatment that you get for cancer, you're randomized to certain arms to get, either treatment or the placebo. That was the same in a lot of, in these studies where patients were randomized either to get one of the interventions or not get it, or maybe get one of the interventions plus another intervention, or get one or the other. So these are all randomized controlled trials that the ASCO committee reviewed in order to make recommendations on cancer-related fatigue. And what they found is during treatment, there is strong evidence that exercise, cognitive behavioral therapy, mindfulness programs, Tai Chi and Qigong, Laura's gonna probably have to correct me on that, I can never remember how to say it, are strong recommendations during treatment based on that evidence pool. And then during treatment, there's also low to moderate evidence to support that psychoeducation, which is basically the education on cancer-related fatigue and how we can, strategies to mitigate it or treat it. And then American ginseng was also on the low level. After treatment, exercise, cognitive behavioral therapy, and mindfulness programs were strongly recommended. And it was, they made it a point to relay or to note that it was not recommended to use L-carnitine antidepressants, wakefulness agents, or routine use of psychostimulants for specifically cancer-related fatigue management. The studies that looked at the evidence of these pharmacological agents, so such as the wakefulness agents, or routine use of psychostimulants like Ritalin, it basically was saying, there's not enough evidence to support that taking this compared to the placebo was helpful in managing cancer-related fatigue. Of course, if you are a patient and you are being seen by your provider and you have fatigue, but you also have, concern for depression or a different type of mental health diagnosis, like antidepressants and treatment for that is definitely something your provider or care team may talk to you about. So non-pharmacological interventions for CRF, there is still low or insufficient evidence that can truly support recommendation of these on the right side. And that's not to say that one of these is beneficial or can be beneficial. It's just saying that based on the evidence pool that we currently have and the review of all of those randomized control trials, those research studies that were done, the committee cannot confidently say that these interventions are helpful specifically for cancer-related fatigue. So, because the main intervention that is the most helpful based on the evidence is exercise, we are going to focus on that for the rest of this presentation, why it's helpful and what's recommended and kind of strategies on how to get more active. So to begin, I think it's really important to understand that these terms, physical fitness, physical activity, and exercise, are not interchangeable. A lot of times they are, used in place of one another, more specifically physical activity and exercise, but they are interrelated. So let's go over why they are different. Physical fitness focuses on really 5 major components, which is your muscular strength and endurance, your cardiovascular endurance, your flexibility, your mind-body vitality, and your body composition. And then physical activity is literally any movement that your body makes that utilizes a muscle contraction and utilizes that energy produced within your body in order to perform that muscular contraction to do a specific task, function, or activity. And then exercise is a more structured form of physical activity that has specific goals in mind, which work on those components of physical fitness. So you do an exercise regimen in order to focus on those components of physical fitness. And when those components of physical fitness adapt and get stronger, then you can perform physical activity with better ease and less constraint. And then, hopefully, then you exercise more and you move more, because when you move better, you move more, and thus the cycle continues. So if you all wouldn't mind, I would love to take a moment. Okay. I would love to take a moment to do a little exercise with you. Hopefully you're all okay with this. I want you to look at this numeric rating scale from 1 to 10 and think about, in this moment, how are you feeling in terms of your fatigue level? So look at this scale, and I want you to write down, if you have like a piece of paper by you and a pen, great. Or even if you're on your phone, do it on your calculator and just write down, or in a note, what number your fatigue is at this moment in time. All right. I'm thinking we had enough time to do that. And you can turn your cameras off, whatever makes you feel most comfortable. I'm going to invite you to stand up. Yeah, you can also put it in the chat. You can totally do that too. I'm going to ask you to stand up, and we're just going to move a little bit together. Doesn't have to be anything rigorous, but we're going to stand up and march in place.
And I'll be at your side forevermore. You know your love his face again. That's why your love keeps on lifting me higher, higher and higher. I said your love
Can you hear me now? The music's like too loud.
lifting me
We're just moving in place. All right. I'm gonna turn the music off there. And we're gonna go to the next slide. All right. I'm sorry that you couldn't hear me, but thank you for following along with the movement. Take a couple deep breaths, get yourself back together and sit down. And now I want you to think about now in this moment, on that scale of 1 to... Oh, I'm sorry. Did someone say something? All right. If anyone needs to say anything, I'm looking at the chat and I don't... Oh, great. That was fun. Okay. Great. Great. I'm glad you guys liked it and that was fun and you enjoyed the song. Now looking at the numeric rating scale again, write down or think about or put in your phone what level your fatigue is at now. Hopefully, if it started out a little bit higher, it came down and you're feeling a little bit better after utilizing your muscles, doing some movement, getting your blood flowing, standing up. Great. All right. So why is exercise so effective in managing cancer-related fatigue based on the research that we have? When you think about cancer-related fatigue, it's this complex multidimensional syndrome, right? Because it's interfering with not just your physical, but also your emotional and or your cognitive health and well-being. So it requires a multi-effective approach to prevent and treat it. And let's now look at the benefits of exercise. Exercise has the ability to improve your cognitive well-being because it supports healthy cognitive functioning. There is something called brain-derived neurotrophic factor, which is a mouthful, BDNF. And exercise helps to improve regulation and maintenance of that. And in doing so, it supports neuroplasticity, neurogenesis, and just overall neuron health, which is why sometimes you can feel, after you do an exercise in the morning or whatever time during the day, if you are feeling a little bit more cognitively drained and you perform some type of movement, you might have a clearer head afterwards. And then emotionally, it influences better mood regulation and improves self-efficacy and confidence. So emotionally, it helps to support proper maintenance of the neurotransmitters that are responsible for your emotional well-being. So that's like your serotonin, your norepinephrine, your dopamine, and that helps influence better mood regulation. And then physically, it improves all of those components of physical fitness that we talked about. Your muscular strength and endurance, your cardiovascular endurance or fitness, your flexibility, your body composition, and that mind-body vitality. So it really is this all-in-one package that helps combat that complex multidimensional syndrome, cancer-related fatigue. And remember, we a little slightly touched on those central and peripheral hypotheses of, why cancer-related fatigue may be happening at that cellular level. So a little bit more in depth. In terms of exercise's impact on those, exercise is also anti-inflammatory. It also promotes efficient energy production. So that energy production that's needed to to utilize energy within your body and then also to support muscle contraction. And it may also improve regulation of cortisol in sleep. What is recommended then that we do? So there are, this varies a little bit from the overall cancer exercise guidelines that are recommended specifically for cancer-related fatigue. The American College of Sports Medicine, who came out with the second cancer exercise guidelines back in 2019 at this point. So maybe a new one's coming soon. They recommend three times a week, 30 minutes of moderate intensity aerobic exercise, and then 2 times a week, strength training. That's 2 sets of 12 to 15 repetitions for the major muscle groups. So those in combination is what they found based on their review of all of the evidence that was done specifically regarding cancer-related fatigue, what is the most beneficial. So exercise can be intimidating. If you're not used to exercising, if you haven't exercised, your whole life, if you haven't exercised for a couple years, even if you haven't exercised for just the past month or week, or you had an injury, or you had a major life event happening, such as taking care of yourself through this cancer care journey, it can be hard and intimidating to get back into it. And I just want to reassure you that, a lot of people feel this way, and your main, you shouldn't be comparing yourself to everyone else in the room. Your comparison is, yourself. And you really are so individual with where you start at with your exercise journey, because every individual has gone through a variety of things. So everyone has a unique starting point based on their diagnosis, their treatment, and their current physical fitness level. A lot of times when people are starting to get active, we tell them, try the 5 rule, which is starting with 2 to 5 minutes of activity. If you feel good, then add another 2 to 5 minutes. But if you are like completely exhausted, rest. And then the better rule, the goal is for exercise to feel better, and you should feel more energized after a session, especially when you're going through treatment. And an exercise, session should not leave you feeling like overly exhausted when you're going through treatment, or even after. So if you feel like so exhausted because you moved so much on Saturday and you are not able to, move well, or like hardly move at all, hardly get off the couch come Monday, Tuesday, maybe you did a little bit too much, and you just need to tone back either the intensity of what you're doing or the duration of what you're doing, so that you're not doing so much where you're pooped out and you're out of gas and you're not able to keep up with the regimen. Then also check in with your care team. There are certain accommodations and restrictions based on your unique diagnosis and treatment, especially if you've had surgery recently. So it's always good to ask your care team, hey, I want to get more active. I think it's going to help with my fatigue. Is there anything that I need to consider? Sometimes they may have you get clearance from your surgeon. They may have some things that you're not able to do, or certain weight restrictions for a certain amount of time. And sometimes they also like you to see a physical therapist first before getting active based on your situation and any trauma that or injury that you may have. So although we talked about what is recommended, though, that 30 minutes of moderate intensity 3 times a week and 2 strength training days per week, that really might be something that you have to work up to based on what current physical fitness level you're at. So maybe if you're first starting, you're just doing 5 to 10 minutes 3 times a week of moderate intensity cardio, walking. And then you're building up from there. You don't have to just go right with the recommendations, because if you do too much too quickly, you may get discouraged, you may get injured, and then you won't stay active. And our goal is to keep you active because we want you to reap all those benefits. So what are the differences between intensities? Moderate intensity, good rule of thumb, you can talk, but you cannot sing. And then when you move into that vigorous zone, you can only say a few words. So if you notice your exercise is, leaving you like really tired for a couple of days, that you're not able to move like you want to, and you're sitting on the couch a lot, perhaps you were in that vigorous zone and you were, kind of doing too much, and you need to tone it back where you can talk but not sing. And then if that's even too much, you can tone it back to like an easy level and where you can sing, and it's, rated on a 1 to 3 to 4 on this rate of perceived exertion scale. The rate of perceived exertion scale is basically just a scale of 1 to 10, rating what you feel like your exertion level is. So it is specific to how you are feeling. Some examples on here. I don't really love to look at examples because intensity levels are unique to each individual. So one should always go off of their own perceived rating of perceived exertion on that specific day. Something may feel moderate to one person, but vigorous to another, or vice versa. And then also just like for yourself, something may feel moderate to you one day, and then it might feel really hard another day. So you're always going off of how you're feeling in that moment on that day. So I really hope that kind of gave you a little bit more information of what cancer-related fatigue was, kind of why it happens, what are some good remedies for it. Mainly, I know we talked about exercise, but why exercise is so helpful, so that you can understand where exercise can, fit in your cancer care treatment plan and how it's going to help you, like propel you forward as you continue to build your strength and endurance. I think I'm at time, so I'm gonna stop there.
Thank you so much, Jenny. Yes, that was so wonderful. Thank you for sharing all of that with the group. So now we'll open it up to questions, and it looks like the first one was regarding the aromatase inhibitors, if you wanted to touch on that. And I'll take any other questions in the chat as they come.
Yeah, I'm going back up. Do we have any information about fatigue related to aromatase inhibitors? Aromatase inhibitors, a lot, those impact your hormones a lot. So that kind of goes into play with like that fatigue of at that like cellular level, and your hormones can interfere with so much, so many different body systems, like your sleep-wake cycle, your stress response, a lot of different things. Specifically fatigue, like I don't know a specific research study that was fatigue geared right to aromatase inhibitors. I just know that based on the bulk of research that's done, fatigue is the best regimen or best intervention for or exercise is the best intervention for fatigue. And a lot of those studies, like for the bulk, are done in the breast cancer population. Breast, prostate, and GI have a lot of research in exercise oncology. I can very well find a research study, particularly on AIs and fatigue, if you were interested in it. But because of that bulk of research comes within that population, definitely like exercise would be like a top intervention for fatigue.
Great, thank you. We've got another one. Wendy's asking about why are Qigong and Tai Chi specifically mentioned as an ideal exercise, and how would they compare with walking or a stationary bike?
Yeah, that's a great question. My thought process on that is because there's a lot of like mental regulation that happens with the Tai Chi and the Qigong. I always say it wrong, even though I try. So that's where my head is leading. We know that fatigue is that multidimensional syndrome. So it's impacting you physically, mentally, and emotionally. And those two exercises definitely help you like be more mindful and slow down and kind of touch on that mental and emotional aspect. I know I haven't done qigong, as you can tell, because I can't pronounce it, but I've done tai chi, and I know after like I leave that, I'm just like I feel so at ease and so slowed down and so clear. So that is my thought process on that. And then walking or stationary bike, you know, that's like more cardio based, so that's going to get your blood pumping a little bit more. Definitely like that cognitive field of increasing that neuroplasticity and neurogenesis. There is research on how cardio can help with that specifically, like even just like one bout of cardio exercise is helpful in kind of clearing your mind. So that just has more of that cardio benefit to it. Yoga is good exercise for cancer related fatigue. Definitely. Definitely. There, like specifically, there's not like a robust amount of research to say, yes, we strongly support this, but there's no harm in doing yoga, especially if it helps. Does exercise?
Jenny, I might add,
Yeah.
well, Cancer Choices has a review of Tai Chi and Qigong, so you might want to look it up. And it's actually classified under two things. One is under energy therapies. So it's part of traditional Chinese medicine, especially Qigong, which it is movement, but it's very slow, and it has breathing that it's coordinated with, as well as an intention for healing. And I'm sure that the traditional Chinese medicine practitioners would say that you are activating the qi, which is the word for energy, and moving the qi and unblocking the energy meridians from keeping the qi from moving in your body. There's a physician, Dr. Cynthia Lee, who started working with people with long COVID early on in the pandemic. And one of the things that she prescribed for them was Qigong. And some started off, they could not even get out of bed. So they were doing it in bed. And then over the course of this several weeks that we were doing the Qigong, people were beginning to be able to do it sitting up and then standing up. So there's probably a lot of dimensions to it, as you intimated.
Yeah. And even just thinking about the ASCO recommendations, right? And they say strongly support mindfulness programs.
Yeah.
And cognitive behavioral therapy. I know that's not cognitive behavioral therapy, but it's a form of mindfulness.
Yes.
Doing those activities, doing those exercises.
Great, thank you. We've got another question about exercise ever triggering fatigue.
Yeah, that's a good question. There is like a very rare, this is probably not what you're referring to, but there's a rare diagnosis where you get like very tired and dizzy when you exercise. I think it's hypotension associated exercise. I can't think of it. So that definitely triggers fatigue. If you are doing, I would say if you're doing like too much, that might burn you out and trigger fatigue. I don't know if Mary is able to like elaborate a little bit more on that question so I can help answer.
Thank
Yeah.
you thank you so much, Jenny. So prior to being diagnosed with cancer, I used to run, and I actually stopped running because there was a point where all of a sudden, and it could have been menopause, like all of a sudden my hormones were crazy, and then it was a point where I actually felt fatigue while I was running. So I have a little bit of a a fear or trauma based on that past experience. But now, post-diagnosis, interestingly enough, I tried to run and it felt great. But I always have this kind of again, this fear like I'm going to be all of a sudden feeling great and then bang, I'm going to feel that ugliness of fatigueness. And I'm trying to avoid that.
Yeah.
So that's where I'm at. I'm just curious if you've heard anything or what would you recommend?
Yeah. I would really say to start, slow and build up. It's hard when you were so used to doing something like so much, especially if you're like an avid runner, to kind of step back and be like, okay, I can only do a mile like 3 times this week, and then I'll increase it to 1.5 or then 2 the next week to go slow because you're used to doing so much more. But give yourself grace. And I would say start slow, build slowly, and then just monitor your fatigue while you're doing it. Even if you have to just write down on a piece of paper what your fatigue level was either later that day or the next day so that oh, maybe I did too much and I'll just tone it back a little bit. Maybe I ran too fast and I need to run a little slower or not do as many hills on my route, um, that's what I would say, to really give yourself grace.
Helpful. Thanks. Thanks
Yeah,
so much, Jenny.
of course. I see
Great.
Michael Sparks. Yeah.
Yes, there's
And you,
some
oh,
I think it looks like there's some commenting on, why acupuncture isn't showing up as having, as being as effective. And I think a lot of that is just due to the evidence base. So,
exactly.
we only can make conclusions based on what studies have been done. So
Mhm.
that might be the case for Tai Chi having the evidence and acupuncture not, because
Yeah.
the study, just the bulk of studies done.
Yeah, which is all the more reason, if you're at an institute and they're looking for volunteers for a study that's looking at, that maybe that's something you do. Because, yeah, the recommendations from like, the national societies have to come from this bulk of evidence that they review. So it's not to say that it's not helpful, because definitely I've had patients and friends that have said that yes, acupuncture has like helped me a lot. There's just not that sufficient amount for them to definitively say yes, like there's strong evidence to support this, because they look at the study and then they also look at the quality of the studies too. So there's a lot that goes into making those recommendations. So hopefully there'll be more information as, research builds on that.
Yeah,
Great,
and,
thank you.
and I'm going to put in the chat, and also we'll be sending you some resources. But Cancer Choices has a review on our handbook on fatigue, and we do list all those clinical practice guidelines that require very rigorous studies. But we also have looked at other studies, and acupuncture does show up. So I'm going to put the link to that page in there, and you can see some other things that are likely to be effective. There just isn't the randomized controlled trials behind it.
Right. And then there's that piece too of, I know Laura, you talked about this for our presentation, is it harmful? Like it's also the risk of harm. So if you tried acupuncture just to see if it helped, there's not, there really shouldn't be much harm in doing that. So even though the evidence is showing insufficient, it's definitely worth, addressing with your care team. And there's probably no harm in you trying it to see if it's effective.
Great. So are there any last questions from the group? Well, a couple of closing thoughts. One, thank you so much, Jenny. This was, wonderful for you to be able to share your wisdom with the group, since you have such specific experience in this space, and I know fatigue affects so many people going through cancer treatments. So thank you so much, and we will be posting the recording of this on the website. So just give us a week or two to get everything tidied up and posted, and it'll be sent out to everyone who registered. Same with any resources that Jenny or Laura have to share. So yeah, if there aren't any other questions, we can close it out. Oh, and one other announcement. We'll be pausing the sessions for the next couple of summer months, but we'll be emailing, if you're already registered for Dr. Mary's sessions, no need to ever register again. You'll just on the list and you'll continue to get notifications for the next session. So as we pause these sessions just for the next couple of months, I invite you to get on the Cancer Choices newsletter, and we'll be having other webinars as we schedule them, and we announce them on our main newsletter. We have one in June for financial toxicity, and that will be up on the website in the webinar section, and that's going to be the first week of June. And it looks like Jenny dropped her email in there, so if folks want to grab that, maybe take a moment to copy and paste. And anything else, Jenny or Laura, before we close?
Just thank you for having me. Thank you, Laura, for asking me to join. And
I'm so delighted you could, and it sounds like Victoria quieted it up.
oh yeah, Vivian Quiet. Yeah, she's
Vivian.
yes,
Vivian.
yeah. She was ready for bed. She
finally got tired.
Yeah.
Yeah. And I'm going to put the link for the newsletter. Wendy says she's not getting the newsletter, so it's right here. If you want to sign up, that's our weekly newsletter where we announce all new webinars and send out articles. And Michelle, you'll have to submit that if you want to grab the loop so you can enter your information directly in. Thank you all for joining, and we'll see you again soon.